Hello and welcome to this week's What Were They Thinking? Among the news items we have for you this week, there is the development of a vaccine for Lyme disease that's now entered into a Phase 3 clinical trial. How the tuberculosis vaccine actually provides protection to more things than just tuberculosis. A case study of a man's voice growing coarser over a year and the mysterious cause. TikTok, yet again, proving that it is truly a blight upon society with its viral advice regarding tampons. Surgical robots are now heading to the International Space Station, and an alternative to palm oil made by yeast when it's fermenting. The timestamps for these and the other news items can be found in the description box below. Starting with the Phase 3 clinical trial for Lyme disease. Lyme disease is a relatively rare condition. It is something passed on to people by parasitic ticks. They infect their host, and from there you are stuck with it. It's generally considered to be endemic, particularly in the USA and Europe. Treating it is, as mentioned, somewhat difficult, but it can be dealt with. Rather than having to deal with it on a case-by-case basis, as has often been the case with many diseases, a vaccine is much easier. This is especially true since the treatment for this includes antibiotics, and the antibiotics can be rather nasty in their side effects. It requires things like doxycycline, amoxicillin, and ceftriaxone. Generally speaking, you will recover from infection with these antibiotics, but why go with a treatment when you could prevent the infection in the first place? This is why the vaccine is so important. Being an endemic disease, being able to stop it, at least in the human element of the vector of disease, means you can do a lot more effectively, and you don't need to worry about, let's say, having to spend large amounts of time, effort, and resources. The newsworthy element to this, other than being a new vaccine in a Phase 3 clinical trial, is that it is a relatively small biotech company that is behind its development. It's a French company called Valneva. Their vaccine is being developed to deal with it and will provide a somewhat niche market treatment. As it is, their Phase 2 trials found between just over 85% to 95% response in adults. This means that it is pretty much as effective as any other vaccine that's going to be out there. Of course, these are the internal results that have been published for the rest of the world to view, and so we should wait somewhat until we have more, let's say, skeptical or at least well-reviewed research into its efficacy. Going from Lyme disease to another disease that we've been dealing with for a very long time, tuberculosis. Tuberculosis is one of the nastier infections you can get. It's a bacteria, but it's a bacteria that is very resistant to treatment, and it takes a long time to resolve. Because of this, being vaccinated for it was the better option. Again, avoiding the problem by treating the underlying issue before it ever becomes a problem. What was odd is that the TB vaccine provided a surprising amount of coverage beyond tuberculosis. And researchers from Australia think they may understand just how this happens and why. They think that it may be down to a change in monocytes, one of the white blood cells that engulfs foreign pathogens and then uses that to help the immune system mount a better defense. What it seems to do is something called DNA methylation, and in doing this, it changes the way DNA is both turned on and off, but also how it's packaged. And in this case, it allows for it to be more efficiently unpackaged and repackaged, thereby allowing monocytes to be able to more effectively respond to threats that it hasn't previously been exposed to. This is distinct from the adaptive immune system, which is the part of your immune system that things like vaccines are meant to train. They are meant to be able to make a better response from subsequent exposures because the adaptive immune system has a memory of sorts. This means that the monocyte's ability to do something similar is both very interesting and somewhat radical, let's say. The researchers note that this isn't a phenomena unique to just tuberculosis vaccines. Things like measles, polio, smallpox, and others all have a similar effect of priming the innate or non-specific part of the immune system to respond better. And while they do explain that this can be bad, in countries where there is a higher incidence of various diseases, particularly those that aren't as developed and have a high infant mortality rate, vaccinating like this could be extremely beneficial in effectively maximizing the benefits of vaccinating. They also point out that it could, in theory, have, let's say, hypothetical benefits in reducing the prevalence and impact of autoimmune diseases, particularly allergies. Going from studying humans to one of our closer relations, gorillas. Gorillas are intelligent, there's no denying this. Despite how they may be perceived and or described, they are, at least significantly, more capable than many other species on the planet. This is where their intelligence becomes very important. Zookeepers in Atlanta have observed their gorillas making vocalizations in order to communicate with zookeepers. This is very unusual and very interesting. It's not new so much that apes have been able to communicate. For example, there have been case studies of apes of various kinds in the past taught to communicate using both words and sign language. But this is the first time that they have started doing so without the intentional education on how to communicate from zookeepers or otherwise some sort of researcher. The researchers note that it's not just this zoo though. 11 different zoos with up to 33 gorillas housed between them have all exhibited similar behavior, with a call that makes it clear that they're trying to get the attention of their keepers. Going from the haired ape to the naked ape, and a case study of a man whose voice grew progressively more hoarse as the year went on, eventually becoming shrill and grating. This is possibly not something new, particularly if you don't commonly talk, and so with the long period of COVID isolation and then returning to a work environment or similar, you may not have the necessary strength built up in your throat. That's understandable. Fungus growing in your throat causing the same thing, not so much. This is where the case study is unpleasant and uncomfortable. The man was in his 60s, and so he is going to have a weaker immune system. Because of this, it's not surprising that he got a progressively worse voice as time went on. The treatment had initially been corticosteroids. These are a fairly standard treatment for any kind of inflammation in your throat or airways. It helps to reduce swelling and thereby, theoretically, should minimize any issues to do with your voice becoming hoarse. That is, if it's caused by inflammation of some kind. In this case, the use of corticosteroids may have had the opposite effect by reducing the immunological response. Fortunately, the treatment is relatively straightforward. Even for this particular kind of fungus, it was a yeast called Blastomyces dermatidis. It's a relatively common soil-borne fungus, and can be treated relatively quickly and easily using antifungals. Unfortunately for this man, because of the severity of the infection, he actually had to undergo surgery to have a breathing tube placed in his larynx, he had to have a feeding tube put in, and then put on long-term antifungal drugs. This was then followed up by regular appointments. Only after 5 months was the breathing tube removed. That is a rather uncomfortable tale, but people are liable to believe anything they're told. This can include stupid advice from TikTok, which is the last place you should be going to for health advice. One of the current, particularly common issues is that TikTok influencers are advising that titanium dioxide in tampons is causing cancer. It does not. Yeah, this is another one of those find a chemical that sounds terrible and then tell everybody it's terrible when it's really not. There have been somewhat entertaining examples of people using dihydrogen monoxide to exactly the same effect. They were able to convince people that the dihydrogen monoxide in their water was dangerous, because their water was contaminated with, well, water. In much the same way that water is naturally in water, titanium dioxide is a natural mineral, and it is used for many different things, not only in food, but health and beauty products amongst many others. The fact is, it is well recognized as being safe. Its primary effect is really just to provide a nice clean white color to whatever it's in. Sadly, the TikTok influencer, at least one of them that is responsible for this, uses the usual process of a anecdote that they then try and expand to apply to everything else. In this case, of an individual who has had issues with their monthly menstruation because, according to them, their tampons had this particular chemical in it. Titanium dioxide does not cause this though, and there is the problem. You can't just extrapolate it out to everybody else because there's been one instance. The article goes on to paraphrase one of the experts in this field's view on this, and it's simply boiled down to titanium dioxide can't be dissolved in such a way that it can be absorbed by the body from the vagina, and because of this, you fundamentally can't get the kind of effect they're describing systemically. It simply can't get into the blood. In fact, it's arguable that it can't get through the cell membrane in the local area where it's being used, and because of that, you're unlikely to see the effect of titanium dioxide on local cells, let alone anywhere else in your body. It doesn't matter what it's being used on or used in. Titanium dioxide, being a metal-based compound, in other words inorganic, can't have the effect they're describing in the way they're describing it. It is biologically, biochemically, and chemically impossible. In other technology-related news, but switching from TikTok to one of the other evils, Google. Google had a problem this week where its servers, and services as a whole, had a technical hitch, let's say. As a result, they fundamentally had to shut down part of what they could do. Google hasn't exactly been forthcoming as to the cause, but the effect is more obvious. There was a huge increase in the number of people reporting that the search engine was simply unavailable. The effect, though, isn't limited to just Google as a search engine. Services like Google Maps were unavailable, and then Gmail and Google Images as well. This means that there was a widespread and quite significant problem with the Google back end. There's an estimate that over 1,000 of their servers had to have been impacted for this to happen, but it also only lasted up to 3/4 of an hour or about 45 minutes at the high end. In 45 minutes, there were tens of thousands of reports of the website being inaccessible. Next, we go from Earth-based technology to extraterrestrial technology. A robot that can perform surgery is heading to the International Space Station. This is the next necessary development as far as space-based medicine goes for not only going to the moon and possibly making a moon base, but then even later on, Mars. The likelihood of being able to get enough qualified and certainly long-term supply of qualified individuals for medical care, especially surgical medical care, is not that great if you have to go all the way to Mars. There will be weeks, if not possibly months of travel, and so you are going to have some sort of facility or service available that will fill this gap. Chances are it's going to be robotic, and robots are already filling a very similar role here on Earth anyway. That's why the test of this on the ISS is rather important. The robot itself is coming out of the University of Nebraska, but it's a collaboration along with NASA and the Goddard Space Flight Center and Jet Propulsion Laboratory. The plan is to be able to make it so that you have access to qualified or at least competent medical care. The technology involved is not that different to what's being used on Earth in many ways. Compared to the difficulties of being able to access something inside the human body as a surgeon, you can get away with much smaller incisions, tools, and more. This means there's less invasiveness to the surgery, and therefore, theoretically, shorter recovery times, less damage, and hopefully fewer complications. Fortunately for the astronauts on board the ISS, they won't actually be subject to any kind of surgery. The robot will be conducting a series of tests rather than any actual surgery. For the most part, this will be things like cutting rubber bands, moving metal rings, and more that are meant to allow it to demonstrate its ability to be delicate and conduct refined actions that would be necessary for surgery. Next we go to some chemistry-related news, although still also health-related. It's debunking a health claim. There is currently a number of people trying to sell what they call structured water. Structured water is supposedly a fourth phase of water. This fourth phase of water is also called hexagonal water, structured water, or exclusion zone water. None of these terms mean anything because it is a load of crap. And that's putting it politely. More so when you're selling it for more than $2,500. This kind of nonsense is on par with Gwyneth Paltrow's several carat gold dildo, jade vagina eggs, supposed NASA space stickers, and other overpriced gimmicks that really aren't based on anything in reality. Chemically, they explain that this is actually water with 3 hydrogens and 2 oxygens. How it achieves this state and doesn't form the more stable H2O that we're familiar with is a mystery, but let's just, for the sake of argument, assume that somehow or other they've found this miraculous chemical that we've missed until now. This is supposed to generate a negative electric charge and thereby create the hexagonal arrangement of atoms in water. This imparts it with certain properties that are beneficial, or at least so claim the people who are selling it. Things like it can flow into cells more quickly, and that it is meant to, let's say, provide more broad health benefits, as they're never going to tell you exactly what they are, or at least not in a way that could be brought back to them. The problem is, none of this is true. If water was able to move more freely into your cells than it already is, your cells would swell and undergo lysis and explode, just like an overblown balloon. This is why it's not possible. Chemically, you have a problem with what's described anyway. If you were to simply bubble hydrogen gas through regular old water, you would find that you don't get H3O2. That structure doesn't occur. At no way, point, or time does one of the hydrogens jump free from one water molecule, allowing it to bind to another. Conversely, let's say for the sake of argument, you were to try and push something like pure oxygen through water. You find these same sort of changes don't occur. In fact, in order to get what they're selling as claimed, you would need the hydrogen ions to be able to have a positive charge, join with the water molecule as it is, and then stay there. But the problem is, although you will occasionally find hydrogen molecules jumping off of water molecules and forming a slight difference, it isn't very much, and it happens so quickly that it's not stable. In fact, it's why water maintains a relatively neutral pH when pure. This is a extremely good example of pseudoscience and woo at its finest. It sounds compelling if you don't know what you're talking about. Finally, we have a palm oil alternative. This is made by using yeast for fermentation. It should be available in Europe in the next year or so. Palm oil is one of the more environmentally controversial products. For its land use, you get much more oil than you would from other possible ways of producing oil. The problem with this is that the land used to grow palm oil tends to be the same habitat for species like orangutans. That means their habitat is destroyed to make land for palm oil. And so you find that you get competitive species issues, you get endangered species losing their home, and there are all kinds of other problems. Even where there are programs to try and maintain the palm oil plantations as they are and maximize yield, there is still questions and opacity around how effective they are, who's actually doing what, and if companies are actually buying palm oil that is from these places. It's why palm oil has a tens of billions of dollars global market share. Being able to effectively create artificial palm oil using yeast removes a whole range of issues. We already have the environmental and animal welfare problems to address. It is, however, going to have an impact then on those areas which are generally less developed that rely on the production of palm oil for an income. The people involved in this claim that their yeast was developed, or in their words, evolved, using a natural process. Note that evolution is on a species scale, so they're already wrong in that respect, and a natural process isn't, well, it doesn't mean much of anything. They say that it was done by taking a yeast strain and over 8 years, directing its evolution, and by doing this, they were able to make it produce the desired product without having to genetically modify it. They compare this to selective breeding of plants, which, again, isn't exactly helpful. There are many ways to selectively breed. Theoretically, you could argue that radiation gardens are a natural selection process, as you aren't genetically modifying them directly, you're just using radiation to create mutant strains until something works. The process after you have this yeast is relatively straightforward though, and this is to produce something similar to beer in a large brewing vat. Instead of beer though, you're making palm oil, or a palm oil substitute. They intend to make this available to the market by 2023. Their challenges currently they face include scale, so how much can they produce? Will it be as cheap, if not hopefully cheaper, than the currently available naturally produced palm oil, and whether or not they'll get approval from regulators to sell it, and more importantly, to sell it as palm oil, or at least something similar enough to be recognizable. That's all the news we have for you this week. Thank you for watching. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions that you have below.